Good afternoon, everyone. I am Dr. Ruchi, and I am here to give my presentation on optical coherence tomography, imaging of proximal lacrimal system. I have no financial relationships to declare. The human lacrimal drainage system comprises an upper and lower punctum situated towards the medial end of eyelids. The lower punctum connects to a 2 mm section of descending vertical canaliculus before turning medially for 8 mm and join with the upper canaliculus, then into the lacrimal sac. Our aim was to study whether OCT may be used to image the punctum and proximal canaliculus. OCT image of the lower punctum were captured with a Topcon 3D OCT machine. Anterior segment module was used. Single line anterior high resolution scanning was used. 52 puncta of 28 subjects were scanned. The punctum was recognizable on the OCT image in all cases. The medial lower end was gently everted to expose the punctum to the OCT scanner with maximum care taken not to distort the anatomy. Canalicular length ranged from 462 to 1242 microns. Mean length was 864 micron. Peak width of canaliculum ranged from 126 to 401 micron with mean width of 234 micron. Punctal anatomy is clinically relevant in the management of epiphora because punctal stenosis is one of the major causes. It is also relevant to design the punctal plug and assessment of their function. However, there are currently no routinely used imaging modalities or objective quantitative assessment systems for the proximal lacrimal system. There is currently no other practical way to accurately image the punctum and the proximal canalicular morphology in vivo. OCT is a practical and readily available tool in most eye clinics. Its resolution is ideally suited to imaging of the punctum and proximal canaliculus. Punctal OCT relies on scanners' infrared beam traveling directly through the canaliculus rather than through the surrounding skin. Alignment of the punctum and the canaliculus with axis of scanner's infrared beam is essential. As the wall of the canaliculus often appear to come together in different shapes, it is difficult to decide which point to measure the diameter of the canaliculus. However, even the longest canaliculus that we imaged was still much shorter than 2 mm. This suggests that during resting period, maximum part of the proximal canalicular system may remain in collapsed state and it was not being picked up by ST-OCT. Probing with a syringe may similarly unreliable since it may cause dilation of the punctum and through not giving an accurate representation of the patient's normal anatomy. There are no routinely used imaging modalities for proximal lacrimal system. Development of an objective system for an imaging punctum is warranted. We can conclude that we have shown that OCT may be used to create a high-resolution image of the lacrimal punctum and canaliculus. Further work is required to establish its clinical applicability on wider scale.